So just a bit of background of myself and Praxis. Praxis is a practitioner-led. One second, can you hear me? Okay, so Praxis is a practitioner-led AI for Good lab. We are a team of two, but we all do have day jobs and we do this on the side. A bit of background about me as well is I'm an epidemiologist, and so I find myself now in this space, and I try to apply some of the epidemiological methods in some of the kind of works we do in detection. One thing that struck me working in this sector immediately was that okay, good. When you look at violent extremist groups, the way they orchestrate and plan, it's really very likely, or it's really very similar to how disease emerges. So the question I started asking myself is that when disease is emerging, it comes with signs and symptoms. Do those signs and symptoms leave? Could do those signs and symptoms apply as well in the area of preventing violent extremism? And I realized that yes, because violent extremist groups, when they start strategizing, the strategy and the way they plan leaves some tracks, and those tracks, if detected early, can be built into signals that we can use for early prevention. So the question I ask myself is that, well, if that is so, then could we apply some epidemiological methods in really this early detection? And the answer I found was yes. So we started off by first starting with a sort of simulation. And so we simulated our 15 years worth of data, just understanding, okay, where exactly do these attacks really start from? And when they start, what warnings do they give before starting? And so immediately when we started this simulation, we realized that kidnapping obviously was the spike, and we used ACLED data, 15 years of ACLED data. Kidnapping was the first spike. And so that we thought that was the right signal. But once we did the bootstrapping across several applications, realized that this was a wrong signal. So then we went into the data and said, okay, well, let's redo this research properly and see where the signal really is. And so for this talk, I'm going to break it into two to talk about the research and briefly also about the system we've built to help produce the signals into operational responses. Just a bit of the methodology here. We used about, as I mentioned, 15 years worth of data, 100,000 ACLED events, and we looked at three regions, but 13 countries. So the Sahel region, the Western coast as well, including Lake Chad Basin, and all the countries, and some of the countries also in Central Africa. The goal is to really scale this up based on this work, but this presents a very good case study on how we can apply some of these epidemiological methods into in this sector. So just a bit of again, looking at the methodology, looking at the predictor and outcome variables here. On my left are the predictor variables, and on the right are the outcomes that we are looking at around this 15 years period. And the shocking thing that we found was that when you pick each of the predictor variables on itself doesn't produce clear attacks. When a spike in any of the predictor variables by themselves do not produce a spike in conflict or a spike in violent attacks the following week. However, when you pair them up, there were some, and here a lot of simulations went in, but the simulation that struck us was combining kidnapping and IED in a region or a district that was previously calm. A spike in that produced about 8.8 times more likely to produce violent attacks the following week. And so that was something that struck the entire team as we did this, but also we realized that different combinations across produce some sort of spikes as well, and obviously anything above one produce some sort of spikes. In fact, at the end, I'll share with you the QR code that you can go into the research and you see the simulations that we did with the different combinations of the events that could lead to different spikes, but that was something that we noted that the co-occurrence of two or more events produced more spikes. Here as well, the obvious thing is, as you can see here, the one and the falsified assumptions that we started before. As you can see, one specific event didn't lead to any form of very high level spikes. Um, again, is that when you pick just the IED plus kidnapping, you realize that the spikes were much pronounced in the Lake Chad Basin compared to the coastal West Africa or the Central Sahel. And I can see, and you can see that even from the geographic regions here, you can see which actor is responsible for what. And so you see that obviously because the Lake Chad Basin is much operated, Boko Haram operates in this area much more. It's very like we see that Boko Haram. This is almost the signature of Boko Haram in using IED plus kidnapping as a precursor to violent attacks, and and although even in Jinim itself, it's very low, and that is why we see they're also very low in Central Sahel, but it's still very statistically very significant, 4.8 times more likely to produce attacks the following week after these events have occurred in the previously calm districts. Now, a brief on the system itself. We call it TREMOR. It's not to scare you. It's the threat recognition and early monitoring for operational response. And the goal here is that should we build this research into a system that provides signals for people working in here? One thing I want to mention is that this system is not meant to be an intelligence tool. It's not meant to be a Palantir. It's meant to rather be something that people, or let's say a tool that people working on the ground can use as signals to just help protect their work and their investments. And our goal as a AI for Good Lab is not to really hand the system over to governments. And so just to mention that, especially in this day and age where AI safety is important. Um, so three layers of this analysis and three layers of this of the system. The first is the data injection. As I mentioned, we get our data from ACLED, and once the data comes through, the analysis that we just showed, there's a pipeline that is wrapped around. So we wrap around this pipeline, create this pipeline. So once the data is injected, there's an agent that takes this analysis, the raw data, and then runs the analysis. And then once it runs it, if there are the spikes in that, it hands it over to the next layer of a bunch of agents. And the most important thing of this bunch of agents is that there is a verification agent in here. And that verification agent within this, what it does is it just tries to verify if it's a false alarm or if it's right. And so if the alarm is right and there is an owner to this spike, then it hands it over to the last agent here to produce the alerts. And so yeah, and so currently we do use the push alert. Our goal is to expand it more to SMS and to SMS alerts, and we are currently talking to a few partners to see how we can scale this up. The third one is obviously the respond one, and the response one. Here I want to mention that the you as a local actor are responsible for deciding what the response should be, whether to escalate or to keep it low. As I said in architecture, is that the response is based on you as an the response, sorry, the spike, every spike is linked up to an owner. What this means is that every spike is linked up to a geographic area, linked up to a district, and once that district is determined, you as a local actor on the ground would have one of two decisions to do. Either you decide to manage this locally or you decide to escalate. But then once the spike comes through, you have four levels or four main things to look at. The first is the situation. So which kind of co-occurring types are there? And here just to mention is that kidnapping plus IED would bring this up to critical to spike it up to the highest level. And then once that comes in, also there's one agent that guides you through to make an assessment of the of the situation, and then you decide what exactly you want to mention. Well, so if you decide to escalate, then whoever is at the team or your highest level would get an alert to help you to guide you through whether or not to pause the program, to move beneficiaries to another level or another location, or yeah, something, or perhaps maybe take another decision at the management level. Finally, just to mention that we do not intend to we do not intend to predict the next conflicts. That is important to mention, and this is not an intelligence product. Just ending by saying that conflict prevention, there's a lot we can learn from epidemiology, as epidemiology has spent about a decade already doing this. I'm sorry, a century doing signals, and so there's a lot that we can learn from the public health sector. And yes, so anyway, if you want to see more of the research, please scan this QR code, and if you want us to talk about more collaborations, please stay in touch, and we'll be happy to talk through what we've done and a few other tools we are building in the pipeline. Thank you very much.